Welcome to Wondrous Roots, your health from the ground up. My name is Rebecca Montrone. Grew up here in Keene, New Hampshire, and as Wondrous Roots, the laugh, I guess, is on me because never dreaming I'd be back in Keene, New Hampshire to live. We are here and have been here since 2000. Well, we've been in this area, the Keene area, back in the Keene area since 2009, and in Keene, started the practice here in Keene, moved to the business here to Roxbury Street in Keene in 2012. So it's great to be here with you all. So I am, if you're listening maybe for the first time, you're seeing me on YouTube or Rumble and you're not familiar with me, I have a degree in holistic nutrition through the Clayton College of Natural Health. I'm certified through the American Association of Drugless Practitioners as a certified holistic health practitioner. So I work with people in private consultation, either here in person in our office, my practice here in Keene, or via teleconference like we're doing here today. All kinds of health problems, whatever they might be. And I really enjoy doing that. I learn a lot from you. I learn a lot when I work with people. Just trying to help them with their health problems. And so anyway, our business location here is 103 Roxbury Street in downtown Keene. It's one of the main tributaries off Central Square. And we are in the Miller Forge building, which is a wonderful old mill building up on the third floor, but we have full handicap access, plenty of free parking. And we are open here. We have open shop hours. So our shop, I have a lot of nutritional supplements that I use with people routinely. Those of you who are in my Wondrous Roots family here are familiar with those. I work a lot with different nutrients and things like that. But then I'm also a full-fledged herbalist. So I practice herbal medicine as well. And so I have a lot of formulas there on our shelves here. And you can also see everything we have to offer on shopwondrousroots.com. So we have a full online store and we ship all over the place every day. So anyway, what else can I say? You can reach us here, 603-439-2603. Our open door business hours are 9:30 to 5, Monday through Friday. And you can reach out to me through the Contact Us app on either wondrousroots.org or shopwondrousroots.com. I think that that is my intro. So we have a lot of fun things happening here. We've got a couple of new sort of holiday time things to unveil next week, but I'm not going to say anything more about them now, even though I really want to. That's really exciting. And then, yeah, so just anyway, get in touch. Okay, so I want to talk about, how to be involved here. So you can participate by either raising your hand and I'll call on you and we'll all be able to hear you speak, or you can go to the chat down somewhere, wherever you are, where your computer, mine's down along the bottom, but then when I share my screen, it'll be somewhere else. But anyway, go to the chat or go to the Q&A. And I will keep an eye out for those things and we'll get in touch that way. So feel free to talk about anything. It doesn't have to be about cholesterol. It can be a question about something totally unrelated. I love that. And I love just fielding questions off the top of my head. I really enjoy that. So don't feel like you're getting me off track or anything. And today's presentation is not as brutally long. I mean, I'll take the whole hour, but I mean, the presentation itself is not as many slides. Well, I say that, but we'll probably, anyway, I'm eager to share. Cholesterol is, oh my goodness, so many people. Cholesterol is kind of like, cholesterol lowering medications are like big pharma's big go-to for making money. They truly are probably the biggest money maker when it comes to chronic medications. And the goal is to get really everybody on them. Some real die-hard cholesterol medication people think that we should put statins in the that's not dandruff, it's a fuzzy. We should put statins in the water supply. So wow, cholesterol, so misunderstood. I call it the Lord and giver of life in our biology. And yet most people, right, have this idea that cholesterol is something bad that we shouldn't have in our bodies, that we get from eating French fries and living badly, and that it's going to kill us. So I hope to show you differently this afternoon. So here we go. I'm going to share my screen. So it always takes me just a couple of seconds. I'm going to maybe first go to, why don't I do this first? I'll go to, my newsletter. I'll share that first. So I say Zoom with me at noon. Join me. I talk about that. And then, well, I don't want to really go out. Maybe I'll go to that after. All right. Change my mind. All right. I'm sharing that. It looks like it's in the green box. So you should all be able to see that. If you can't, let me know. I'm going to move my things around on my desk a little bit. Move the chat. Whoops. That always happens. Whoops. Move my chat over here. Move you guys. My list of you over here so I can see what's going on. Okay, very good. All right. And you should all be able to see that. If you can't see or hear or anything goes wrong, let me know. Okay. So anyway, the truth about cholesterol. What is cholesterol? Like a lot of people, I think we don't even really know what is cholesterol in the first place. Well, thanks, Dale. And then, okay. So let's dig in. And I am going to show you, well, I'll show you that after. All right. So the natural steroid hormones are generally synthesized from cholesterol in various organs. So the natural steroid hormones, like all of our steroid hormones, right? Like testosterone, estrogen, progesterone, pregnenolone, or all DHEA. You've heard me talk about these hormones many times with regard to health. Well, they all come from cholesterol, including the gonads. And so gonads would be testicles in men and ovaries in women, and adrenal glands. These hormone building blocks are known as lipids. Further conversions and catabolism occur in the liver and in other peripheral tissues and in target tissues and organs themselves. The synthesized hormones can pass through the cell membrane as they are fat soluble and then bind to steroid hormone receptors to bring about rapid changes within the cell. Steroid hormones are generally carried in the blood bound to specific carrier proteins such as sex hormone binding globulin or corticosteroid binding globulin. So these globulins, so depending on what they're going to be doing, right? Because we're going to see here in a little bit that corticosteroid binding, you need cholesterol to make the stress hormones in the adrenal glands in order to deal with stress. So anyway, cholesterol is a waxy steroid metabolite, which regulates the fluidity and permeability of cell membranes. Oh, so let's just get rid of it. In addition, it is also an important component for manufacturing bile acids, so that's digestion, vitamin D, and other steroid hormones. Cholesterol is the principal sterol synthesized in the body. Again, principal, Lord and giver of life within that context. I always tell people without cholesterol, you are dead, and without enough, you are not healthy. So let's clear up the bad reputation of this poor, misunderstood substance. It is the precursor to all other hormones downstream in the steroid hormone cascade. There we go. So here you can see a very nice diagram, how hormones are made in your body. It all starts with cholesterol, pregnenolone, and then we've got some different things that are synthesized or downstream. So we say upstream. Cholesterol is the most upstream hormone. So here we see it up here. And then pregnenolone. And now we have pregnenolone 17-OH and then DHEA. And from DHEA, then we just also from pregnenolone get progesterone. And then we get this form of progesterone. And then we get this androstenedione. So this is involved with the adrenal glands. And then from progesterone, we get these are all involved with the adrenal glands, cortisol, dextrose, all of this stuff. Without cholesterol, we have none of this. You cross out cholesterol, you cross out everything. And your testosterone, your estradiol, hydroxy. Okay, so all of this, super important. These are all adrenal hormones. adrenal hormones. The adrenal glands are critical to health, and they're super critical when it comes to being able to handle stress, which is often one reason that we see cholesterols rise in people is because of, can be because they need more stress hormones made. And so the body naturally increases the cholesterol level. Your body is there and it's created to do things in a certain way. So when we just take drugs and modify how that works willy-nilly, you can be sure we're going to run into trouble most of the time. Not saying that there isn't a place for drugs, you know that, but what I'm saying is when we say, oh, the cholesterol level's out of range, let's just get it in range, whatever we have to do. Or the thyroid hormone is out of range. Let's just get it in range. Whether the person is actually benefiting from it being in range or not, let's just get it in range. And then we treat those laboratory data, and we say, see, that person's in very good health. Not always the case. So this is poor, misunderstood cholesterol. In spite of all the press, what many of us don't know is what cholesterol actually is, where it comes from, what its functions are, and why cholesterol levels are higher in some of us than in others. And I'd like to do my best to shed the light in the space of a few informative paragraphs. So this is a piece I wrote several years ago, but I am going to go through it because I just did a good job with it, and I might as well, right? So if there's one big health topic that might be considered the most confusing of our time, it is the role of cholesterol in disease processes, specifically cardiovascular disease. For years now, we've been thoroughly convinced by the mainstream medical media and popular health press that high levels of cholesterol are responsible for the buildup of plaque in the arteries of those with atherosclerosis, or hardening of the arteries, causing vessel occlusion, blocking, and potentially resulting in heart attack or stroke. Just watch a few of the thousands of statin drug advertisements you'll be subjected to in a year of moderate television viewing, and you'll be convinced that cholesterol is a very, very bad thing, whatever it actually is. And then having the lowest possible level of cholesterol in your body is a very, very good thing when it comes to maintaining and preserving health. Anyway, then I say that. Okay. What is cholesterol anyway? The Lord and giver of life. It is a steroid hormone, and in our bodies, most of it is manufactured in the liver. We call cholesterol the most upstream hormone, blah, 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 blah. Okay, so I promise you this is not going to be boring. Far from being isolated, disintegrated systems, all of our organs interact and depend on one another. And I'm going to just make this a little bit bigger. Some more closely than others. This is especially so when we're talking about the pancreas, which controls blood sugar and insulin control, right? We think diabetes, the pancreas. The adrenal glands, stress management, and the thyroid gland, which regulates metabolism. These three organs are crucially interrelated. The adrenal glands play a significant role in regulating blood sugar, for example, and they also facilitate the conversion of thyroid hormone T4 to T3. The biologically active form we need in order to truly be clinically euthyroid or normal. In other words, yes, your TSH looks normal, but you also feel normal again, not just your TSH looks normal. Okay. Okay, so then I say, yes, it is important to realize that when T4 levels are adequate, standard thyroid testing will return a normal result, but if the conversion from T4 to T3 is not adequate, clinical results will not be enjoyed. Sure, your TSH number will look fine, but you will still experience symptoms of hypothyroidism, such as difficulty losing weight, dry skin, thinning hair, fatigue, cold hands and feet, constipation, you name it. These few things taken into consideration. It is apparent that when the adrenal glands are not functioning optimally, several areas of health can be affected. So again, we're holistic, right? Mainstream medicine tends to look at things in a specialty. I'm going to send you to a GI specialist. I'm going to send you to a neurologist. I'm going to send you to an endocrinologist. I'm going to send you to a urologist. And it's great to have practitioners who really specialize in a certain organ system. Unfortunately, the downside of that paradigm is that many times the connection between them is not realized, it's not appreciated, is not understood. And that's where mainstream medicine really falls apart to a certain extent, because somebody will have, okay, I'll give you a good example. And somebody asked me, one of my clients and one of the guys who tunes into these things, he loves it when I give case studies or whatever. So I had a woman in for a full new consult this past week who mentioned that as a child, now she's somewhere around 50 years old. As a child, she had two problems that have persisted. One was what she called a speeding heart, they called it. So it was like her heart would, tachycardia, her heart would go off racing. And then the other was really severe constipation. And she mentioned that somewhere along the way as an adult, one of her doctors told her in order to stop the racing heart, the speeding heart, to dunk her head in cold water. And I said, well, that was because it adjusts the vagus nerve. And then we went into a whole long time of investigating the role of the vagus nerve on the bowels and on digestion and on constipation and the role of the vagus nerve on the heart rate. And what happens is when you dunk your head in cold water, you actually shock your system so that the sympathetic nervous system, which is what we sort of control ourselves, or that is, what do I want to say? The things that are things that we do, like walking or running or doing whatever like that, right? That is now subdued, and the autonomic nervous system, which is controlled by the vagus nerve, and things that we don't control, that we can't control, like our breathing rate and our heart rate and our digestion, this now accentuates. And so when you do that, if you're having a speeding heart, a tachycardia, you can plunge into cold water and shock your system into bringing that heart rate down. But this is the kind of thing that a person like my client will go and see a doctor about the heart. And the doctor will try to treat the heart, and then we'll go to see a doctor for the gastrointestinal issue. And the gastroenterologist will try to address this constipation. And then we can go back and find this one really major root of the vagus nerve. So then, to piggyback on that, I told you I'd use the whole hour, even though it's fewer slides. To piggyback on that, I had a client who is a longstanding client. She came in for a follow-up yesterday, and she was mentioning that because she loves to swim, no matter how cold it is or whatever. And she said, we just started doing this polar plunge, polar immersion, I think they call it. And she was saying how great she feels with that. Well, one of her problems is longstanding constipation and digestive issues and things like that. And in fact, she even has a history of biliary duct cancer. And so I said to her, well, she goes, people are saying this does so much. This immersion, this polar immersion is so great for so many things like inflammation and depression and anxiety. And I said, it's the vagus nerve. And then I went on to show her all of that. And she goes, I never would have thought. She goes, and then I told her about my other client, and I told her about, blah, 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 ducking the head in the cold water. And she said, well, I think even if she just did the cold water from like the neck down, because the brown fat up here on the neck, or the vagus, or something, she talked about the brown fat, that doing these polar immersions is really good for weight loss too, because it stimulates the brown fat, which burns calories. And so when she was sitting here, I looked, vagus nerve and its influence on brown fat, there it is. So I'm going to do another whole program on vagus nerve. But this, again, is an example of how the mainstream medical paradigm that we have running our medical system right now misses so much, so that you have a woman now who's 50 years old and has been having constipation since she was a small child, and was having this speeding heart, and nobody ever being able to actually say, if you can find how to stimulate your vagus nerve on a daily basis, which I showed her how to do that, we can make some inroads here. So anyway, everything's connected. So the adrenal glands, cholesterol connection. The adrenal glands sits one each on top of the kidneys and manufacture the fight or flight hormones epinephrine and norepinephrine, known as adrenaline. They also produce the prohormones pregnenolone and DHEA. And from there, the hormones testosterone, progesterone, estrogens, cortisol, and the mineral corticoid aldosterone, which influences blood pressure. Except for the production of estrogen from the ovaries, progesterone from the ovaries, and testosterone from the testes, which all begin as cholesterol, the adrenal glands are responsible for the production of our steroid hormones, including all of the sex hormones. They need raw material, however, to spin these hormones, and that raw material is none other than the much misunderstood and maligned cholesterol. Results of the numerous studies have revealed a connection between hypothyroidism and high cholesterol. The thyroid gland is responsible for the efficient metabolism of cholesterol, and when the thyroid gland is working suboptimally, the cholesterol is less efficiently recycled to the liver from the blood, and blood levels will rise. When cholesterol is returned properly to the liver from the blood, some of it is used in the production of bile from the gallbladder, facilitating digestion. So you can see here that a low functioning thyroid can influence not only your cholesterol levels, but your digestive health. And that's a classic thing we see in hypothyroidism is constipation. It's very common. It is not uncommon to find gallbladder and thyroid problems in the same person. So think about that if you know people with those problems, or maybe you're sitting in that camp. Thyroid hormone is so influential when it comes to cholesterol that the cholesterol blood level test has been called the old man's, no, not the old man's thyroid test. I got that wrong. The poor man's thyroid test, not the old man's. Sorry about that. But doesn't high cholesterol cause heart attacks? First, it's important to understand that in spite of all the hype, scientific studies demonstrate that cholesterol levels are not related to heart attack in women at all. And only in 5% of men who suffer heart attack, men in their 30s and 40s, men with a total cholesterol level higher than 350 nanograms per milliliter, right? So 350. Arterial plaque contains only a small amount of cholesterol and is composed primarily of calcium. Plaque forms in the arteries in response to inflammatory damage in an effort to form a scab to a damaged area and prevent death. Okay, so causes of arterial inflammation, diet, okay, wear and tear. So again, high levels of sugars, grains. What we want to say is omega-6 oils, like found in vegetable oils and seed oils and margarine and all that crap. Wear and tear. Okay, so arterial inflammation comes with time because the arteries are constantly pumping, they're working, and so they get tired and they can start to break down. That's why keeping the collagen epithelium, the integrity of the arterial epithelium healthy, which we can do in many ways, is very important. So Nobel Prize winner Linus Pauling stated that to remove plaque without healing the artery first is like removing a scab from a wound. So we keep the collagen up, we keep our tenderly taking care of our arterial health. Infectious organisms can also cause inflammatory damage to the arteries. So it's really important that, this is why sometimes when people have like heart valve issues and things like mitral valve prolapse, they're prescribed antibiotics when they go to get their teeth cleaned because of all the bacteria in your mouth and all that kind of stuff. Remember, the stress hormones are spun in the adrenal glands from cholesterol. A man in his 30s and 40s is typically under a significant stress load, as these are the years when he's proving himself through his success in his career and family life. When a man is under a great deal of stress, has a heart attack, and happens to have high cholesterol, it might not be quite as simple as attributing the heart attack to the high cholesterol level. The heart attack could be due to the stress alone, the high cholesterol indicating the body's attempt to manufacture its defense, cortisol from the adrenal glands, or the heart attack might have been due to an occult infection with the high cholesterol indicating efforts to enhance immune response. Modern medicine approaches the presumed problem of high cholesterol working at the branch level rather than the root level. Too much cholesterol, simply take a statin drug and artificially lower it. Sure, you may still have adrenal dysfunction and or thyroid problems. You may still have chronic inflammation in the arteries, causing damage to the epithelium and inviting the formation of plaque, but you will still enjoy the bliss that comes with ignorance, assuming that your lower cholesterol levels means you are in better health. No, this is wrong. The truth, you are not healthier because your cholesterol levels have been artificially lowered. In fact, you may have unwittingly opened a whole new can of worms when it comes to health problems. Your statin drug will not only turn off cholesterol production in the liver, but also of carnitine and coenzyme Q10, necessary for producing the energy of all your muscles need to thrive, including your heart. Vitamin D3 production will be curtailed, further weakening immune response. Your too low cholesterol levels will also impact your sex hormone production, as the supply of raw material needed to make them dries up. Soon, as my pharmacist father, E. George Wrench, quipped, not only will you be paying for Lipitor, but for Viagra or Cialis Kuching. So anyway, I'm going to go back here to my presentation. So this is an article I love to share with people, and I have been doing this for years and years, sharing this one since I've been in practice. This one is really cool. The health benefits of high cholesterol. This guy is an MD and a PhD. People with high cholesterol live the longest. I'm not going to read all of this. You'll be very happy to hear. But this first part, people with high cholesterol live the longest. The statement seems so incredible that it takes a long time to clear one's brainwashed mind to fully understand its importance. Yet the fact that people with high cholesterol live the longest emerges clearly from many scientific papers. Consider the finding of Dr. Harlan Krumholz of the Department of Cardiovascular Medicine, blah, 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 who reported in 1994. Oh gosh, I mean, so again, do you see my irritation coming through here with this? 1994. Old people with low cholesterol died twice as often from a heart attack as did old people with a high cholesterol. Supporters of the cholesterol campaign consistently ignore his observation or consider it as a rare exception produced by chance among a huge number of studies finding the opposite. But it is not an exception. There are now a large number of findings that contradict the lipid hypothesis. To be more specific, most studies of old people have shown that high cholesterol is not a risk factor for coronary heart disease. This was the result of my search in Medline database for studies addressing that question, says Dr. Runskoff. 11 studies of old people came up with that result, and a further 7 studies found that high cholesterol did not predict all-cause mortality either. Now consider that more than 90% of all cardiovascular disease is seen in people above age 60 also, and that almost all studies have found that high cholesterol is not a risk factor for women. This means that high cholesterol is only a risk factor for less than 5% of those who die from a heart attack, the men in their 30s and 40s I was just talking about. But there is more comfort for those who have high cholesterol. 6 of the studies found that total mortality was inversely associated. Total mortality, death from any cause, was inversely associated with either total or LDL, the bad cholesterol, right? LDL, you've got that bad cholesterol, that's high, that's bad, or both. This means that it is actually much better to have high than to have low cholesterol if you want to live to be very old. So here you have the higher the cholesterol, the total cholesterol and the LDL, and death from all cause. Okay, so what we'd say, diabetes, heart disease, cancer, whatever else people die from, other diseases, whatever the cause, the higher, the lower the rate of death. So we have been being sold a bill of goods, and it is a great bill of goods for Big Pharma. And it is a point of contention between patients and their doctors. We've got some doctors who are dig their heels in, very adamant, don't want to work with you if you will not accept their statin drug things. In fact, the American Heart Association has come out with an app now that doctors think is so great. It's so foolish. You can plug in random low cholesterol numbers. I've tried it. And it comes out telling you need a statin drug and that you have a risk of heart disease. And they're like, I had a client tell me, oh, his doctor pulled out, oh no, we have this new app we use now. What's this? And what do you do? Smoke? Do you blah, blah, blah? Yep, see, you need a statin drug. You need one. How convenient. So anyway, all right. So High cholesterol protects against infection. This is really important to understand. And it's actually the low density lipoprotein that is involved in that process. You know, low cholesterol and HIV/AIDS. So here we see a connection between people having more of a problem with that. It says here, young unmarried men with a previously sexually transmitted disease or liver disease run a much greater risk of becoming infected with HIV virus than other people. The Minnesota researchers now led by Dr. Amy Claxton followed such individuals for 7 to 8 years. After having excluded those who became HIV positive during the first 4 years, they ended up with a group of 2,446 men. At the end of the study, 140 of these people tested positive for HIV. Those who had low cholesterol at the beginning of the study were twice as likely to test positive for HIV compared to those with the highest cholesterol. Very immune system, where we can find LDL cholesterol is very important for preventing cancer. So because of its effect on the immune system. Chronic heart failure, we've been talking a lot about that. By the way, of course, you know, this PDF will be up on my my page, my research information page, which I'll send as a link in my newsletter that says the video's up later today, probably this evening. But you can click on the PDF and you can get all of these articles that I'm referencing. So this is the one we're in at the moment. Smith-Lemli-Opitz syndrome, which I know very little about. You have probably never heard about. Other protecting lipids. Cholesterol is a risk factor, response to injury. So anyway, very, very interesting. Now, moving beyond that, and again, you can bury into that if you're, and I read all of that. Does high cholesterol lead to living longer? Dear Rebecca Montrone, this was an email from gentempo.com. Dear Rebecca Montrone, is it possible that doctors have gotten cholesterol all wrong? Did they know who they were even talking to? Oh my goodness. No. It turns out that having high cholesterol may not increase your chance of developing heart disease and may even be beneficial. This was when this just came out, September 7th of a couple of years ago. Right. Kathy, I can't believe you're here. I am so very thrilled. Dr. Kathy, I hope you don't mind my saying this, but has recently, who's always with us and has missed 2 classes only, recently had a stroke. And she had, and she's in rehab at the moment. And so she is having, she said she doesn't mind my explaining this. And I want to tell you, Kathy has the MTHFR defect, the double gene defect in the one that causes high homocysteine that we see related to elevated blood clotting and that kind of thing, stroke, heart attack, and everything. And 5 days prior to her suffering the stroke, she had had anesthesia to have major work done on her teeth. And I believe that's a long story, but another good case study here that the effect on that, because those that anesthesia can have 2 days prior, okay, correct myself. Kathy, it's so great to have you here. I'm so thrilled. 2 days prior, she had this procedure, and then she's out shopping, doing something, and she has a basal ganglia stroke, and totally paralyzed on her right side, I believe. But of course, this is what they do. They bundle drugs, and yeah, she said it was her right side, and it's great to see you texting here. It's just so great. She's in Danbury at a really excellent rehab facility, and she'll do great. We were able to get her doctors to approve she's on a lot of supplements, right? But they're not going to approve them all. We were able to get them to approve all of the ones that are critical to getting her to really rehab fast and get back. So that's been wonderful, but what a struggle. But I do want to say, you will be bundled, Kathy, your statin drug. And as soon as you are out of rehab and on your own, you can stop it. You know, in the meantime, they say full recovery, Yay. Thank God. Thank God. Wow. Well, you have a story to tell when that's all done, but that's not easy. That's a grueling process. But she's getting the best of care. But yeah, what you do is you take, oh, only 2 weeks, till she's done. That's super exciting. I bet you're exhausted day to day. I bet that rehab is grueling and frustrating. But anyway, yeah. So that's what they did. When my dad had his heart attack and he had the pulmonary fibrosis and everything, they too, when he was in the hospital, had him on a statin drug, which I simply DC'd as soon as he was home. So you're doing so many other things that are really good for you. Don't worry about the statin drug for these rest of the remainder of the 2 weeks, and then you can just drop that from your meds, and it will not. That is just part of what they do. They bundle it. And they say, well, it must be, right? I mean, anything like that, it must be cholesterol. It's not cholesterol in your brain that caused the basal ganglia stroke. I can promise you that. And you need cholesterol in your brain. We're going to be talking about that in a moment. Yeah, it'll take time and outpatient rehab. Yeah, I'm sure. I'm so glad you're here. I'm so glad you're recovering. This is so wonderful. Okay. So anyway, a number of studies have found that when it comes to aged people, high cholesterol is associated with a longer lifespan. And it is well established that as people age, total cholesterol either becomes less of a risk factor or has no effect on all-cause and cardiovascular mortality. But that does not stop doctors and pharmaceutical companies from prescribing statin drugs to lower your total cholesterol. Anyway, this goes into, luckily, there are studies that we can turn to for better insight. Population studies conducted in Japan reveal that people with higher cholesterol, regardless of age, live longer. It was discovered that there was an inverse relationship between total cholesterol levels and all-cause mortality or low-density lipoprotein. We just referenced that. The Netherlands, Leiden, has the lowest death rates and the greatest cumulative all-cause mortality for people over 85, while the elderly in Finland with a cholesterol level greater than 232 has the lowest death rates. So if you have a level total cholesterol of 232, your doctor is going to tell you, oh, your cholesterol is high. You need to go on a statin drug. Honolulu Heart Program found an inverse relationship between total cholesterol and death rates in elderly people aged 71 to 93. Doesn't it make you feel good to have this behind you, to be able to say, I can say with confidence, I don't want to do this. And you can click on these. Oh, Susan saying, sending prayers to Kathy. Yes, everybody, let's be praying for Kathy. And I really hesitated to say anything about this because I didn't have Kathy's permission and I just wanted to wait and see how, but to have Kathy on today, I'm thrilled. Kathy was hoping this might happen because I know technically we've been in touch. So I'm thrilled. The above data causes one to doubt the efficacy and safety of statin medication, blah, 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 blah. Yes, it does. Okay, now, what about statin drugs? Widely prescribed, but dangerous. The great cholesterol scam of the dangers of statins. Now, this is really interesting because I put this presentation together like Tuesday night, I think it was, of this week. And, and then last night I was kind of, looking at it, kind of like tidying it up, editing it a little bit. And in my email, well, first I wanted to clean up my email, like all my email that I hadn't gotten to in a couple of days. And one of them was Mercola's newsletter. And he had in his newsletter from yesterday, this piece, and I went right to the Midwestern Doctor on Substack to his version of it. But I thought how timely, and this piece is really long and you can go into it. It's very deep, but there are some highlights I want to hit. But this one thing that the Midwestern Doctor says, who on Substack never identifies who he is by name, which is very interesting. I wonder why he's doing that. Maybe it's because, I don't know, of his patient pool, or I don't know. But anyway, within cardiology, I believe one of the most damaging falsehoods is that cholesterol causes heart disease, and that taking statins or their newer equivalents, which lower cholesterol, are the key to preventing heart disease. This is because, in addition to those facts being incorrect, statins are also some of the most dangerous and widely used pharmaceutical drugs on the market. So we go there. Yeah, I'm going to show it to you, and then I'm going to go to some of the things I hit. Go through some of this. Sorry, I meant to mute that when I cleared my throat so rudely. There's widespread belief that elevated cholesterol is the cause of cardiovascular disease. However, a large body of evidence shows that there is no association between the two, and that lower cholesterol significantly increases one's risk of death. An alternative model, which the medical industry buried, proposes that the blood clot that the body uses to heal arterial damage, once healed, creates the characteristic atherosclerotic lesions associated with heart disease. The evidence for this model, in turn, is much stronger than the cholesterol hypothesis and provides many important insights for treating heart disease. But we also know the calcium deposition in the plaque, and calcium with minus using DHEA, and which comes from cholesterol. Now that you think of it, right? DHEA, vitamin D3 and K2 remove that calcium from the arteries and put it into the bones where it belongs. So we've got all of that. That's Linus Pauling. Vitamin C, the collagen. Vitamin C is huge in pulling that calcium out of the arteries. And so starts about that. Cholesterol and heart disease. We've talked a lot about that. Again, this is a really long, this is 28 pages. But you've got it. You've got the link to it right there in my presentation. Statins marketing. One of the consistent patterns I've observed within medicine is that once a drug is identified that can beneficially change the number, not the health of the person, but change that number. Medical practical guidelines will gradually shift to prioritizing treatment that number, prioritize treating that number, and before long, rationals will be created that require more and more of the population to be subject to that regimen. I would say protocols will be created, rationals. I really get that. In the case of statins, prior to their discovery, it was difficult to reliably lower cholesterol. But once they hit the market, research rapidly emerged stating that cholesterol was more and more dangerous, and hence that more and more people needed to be on statins. And that chart really doesn't thrill me. Doesn't really matter that much to me. But anyway, and we're using it more and more. We're using them more and more. Now, if I go from here, and this I haven't listened to, whoops, because it's long, like it's really long. Oh, and you can't click on it there. But I have this link on my page. Oh, no, I don't. I'll have to put the link to this actual video on my cardiovascular page. I'll do that. And then it will be there when I release it, my video and stuff later today. One of the remarkable facts, it's like 3 hours long. One of the most remarkable facts Asim shared was that the previously mentioned statin collaboration, which Raranol, I don't even know what that means, Gene. But anyway, I think he meant like a regimen. Anyway, in their marketing, also created a test one could utilize to determine if one was genetically at risk for statin injury. And in their marketing, the test said that 29% of all statin users were likely to experience side effects, which they then removed once attention was brought to it. 29% of all statin users were likely to experience side effects, but we're talking about side effects that they notice. Okay, in addition to doctors being forced to follow these guidelines, patients often are too. Doctors often retaliate against patients who do not take statins, similar to how unvaccinated patients were denied essential medical care during COVID-19. Employers sometimes require cholesterol numbers to meet a certain threshold for employment, although they never did anything on the scale of the COVID-19 vaccine mandates placed on workers around America. Similarly, life insurance policies often penalize those with unsafe cholesterol numbers. This is very troubling because this is how we get controlled, and our healthcare is controlled, and our health is controlled. My primary issue with the statins is not the fact that we waste billions each year on a useless therapy, approximately 25 billion per year in America alone. Oh, ka-ching, who wants to get rid of that? For example, the existing studies find between a 5 and 30% rate of injuries. And Dr. Malhotra, having gone through all the existing evidence, estimates that 20% of statin users are injured by them. Likewise, statins are well known for having a high percentage of patients discontinue the drugs due to their side effects. Found 44.7% of older adults discontinue the drugs within a year of starting them, while another large study of adults of all ages found 47% discontinued within a year. Well, good for them. Linked to a large number of complications that have been well characterized and described throughout the medical literature. Now, what's really cool about this paper is this man has everything. I say man, I'm not sure why I think it's a man, but anyway, this author. Okay, so here you've got you can really go into a deep tunnel with this stuff. Look at all of these references that you can follow to see. And these things are, just randomly pick one. These are all in the National Library of Medicine. So these are not, I read from some, fringe sort of cuckoo, sort of holistic person, Rebecca Montrone. I've heard from, no, sorry. This is all here, but let's look at these side effects. One group of side effects are those perceived by the patient, okay? Which often are what they don't want to take the medications anymore. A high incidence of muscle pain. Well, you're stopping your liver from making CoQ10, which is one of the major of the two enzymes that fuels your mitochondrial energy that we make ourselves in the body. And L-carnitine, which is an amino acid synthesized in the liver, which is vital for muscular mitochondrial energy. So a high incidence of muscle pain, fatigue, especially with exertion and exercise, muscle inflammation, autoimmune muscle damage. So now here we've got, let's just randomly pull one of those up. Statin-induced autoimmune necrotizing myopathy. Oh, wonderful. Necrotizing myopathy. That's like your muscles are dying. That's why that rhabdomyolysis is the thing they tell you on the ads, like when they're in the fine print at the bottom, they're like, it can cause a rare but fatal problem, rhabdomyolysis. That's because your muscles are so robbed of energy by the shutting down of CoQ10 and L-carnitine that they're dying. The cells are dying and they're overflowing your kidneys with dead debris, dying muscle cells, and your kidneys can't keep up with it and you die. Okay. Psychiatric and neurological issues such as depression, confusion, aggression, and memory loss. And look at all of the references pertaining to that. And this is what we're going to do. We're going to put older people on these things, and they've already got these problems are part of what we consider a part of aging, right? Memory loss. Oh, you're getting old. Well, you're giving me too many drugs. How about that? Severe irritability. Oh, and I'm not even on a statin drug. Well, I feel severely irritated on this, but I don't have severe irritability, but I'm severely irritated by this topic. Sleep issues. Oh, great. Musculoskeletal disorders and injuries. Sudden hearing loss. Wonderful. Statin use and sudden sensorineural hearing loss. Wonderful. Gastrointestinal distress. The other group are those not overtly noticed by the patient, but these are things that we can associate based on studies. Type 2 diabetes development, particularly in women, cancer, liver dysfunction and failure, cataracts. Please, ALS-like conditions and other central motor disorders like Parkinson's disease and cerebellar ataxia, lupus-like syndrome, susceptibility to herpes, shingles. Oh, great. And that's another thing that's plaguing our population these days, right? The older problem, just get your shingles shot, take your statin drug and come get your shingles shot. Interstitial cystitis in women, very painful bladder situation. Polymyalgia rheumatica, a client with that, and then again, an autoimmune immune attack, very closely related to, well, it doesn't matter, but anyway, very painful, rheumatica. Kidney injury, renal failure. Okay, again, kidney injury, renal failure. Yeah, you've got all these dead muscle cells coming through your kidneys, and the kidneys are like, what are you doing to me? Anyway, so we have that. You can see a lot more there. This is a really good paper. I'm not going to go there since we just went through that, but this is very, very excellent. Written by, if you're familiar with Weston A. Price Foundation, we have here dangers of statin drugs, what you haven't been told about popular cholesterol lowering medicines, how statins work, cholesterol synthesis. So you start out with acetyl-CoA, which is really, really important. This mevalonate is really important in order to, here you've got ubiquinone, which is CoQ10. Dolicol is very, very important for your brain. In fact, if I go back to that other paper, but this is the level at which you've got the statins interfere with cholesterol production. And it really interferes with so many things that are important for health here. Enter the statins, muscle pain and weakness, neuropathy, peripheral neuropathy related to that. Neuropathy is horrible. Heart failure because of the CoQ10 depletion. Dizziness is commonly associated with statin use. Pressure lowering effects, cognitive impairment, just what we need. Cancer. In every study with rodents to date, statins have caused cancer. In every study with rodents to that date, studies have caused cancer. Statins have caused cancer. Why have we not seen such a dramatic correlation in human studies? Because cancer takes a long time to develop, and most of the statin trials do not go on longer than 2 or 3 years. Still, in one trial, the CARE trial, breast cancer rates of those taking a statin went up 15%. Now, this is another thing. So Kathy, as soon as you're out of there, because Kathy's already had, I'm sure she doesn't mind because I've just put everything else out on the table. Kathy and I started first working together way back when she had breast cancer. So yeah, that'll just be getting nixed once you're out of there. But don't worry, in the meantime, you're on enough things to make up for it. Went up 1,500%, people. In the heart protection study, non-melanoma skin cancer occurred in 243 patients treated with simvastatin compared with 202 cases in the control group. Manufacturers of statin drugs have recognized the fact that statins depress the immune system, an effect that can lead to cancer and infectious disease, recommending statin use for inflammatory arthritis and as an immune suppressor for transplant patients. So pancreatic rot, oh, that's great. There's your blood sugar and all of that. Depression. One of the most recent found that women with low cholesterol are twice as likely to suffer from depression and anxiety. Researchers from Duke University Medical Center carried out a personality trait measurement on blah, 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 blah. Any benefits? Okay, there we go. So, now I want to go back to this article briefly. Oh, I think I actually put it in here. No, I think I want to go back there for 1 second. Hang on. Damage crisis. Okay, he talks about this. The statins come in here. Here you're going to, acetyl-CoA is very, very important, and we need acetyl-CoA. We need it for our brains. We need it anyway. We've got right here, the statins come in with something that's supposed to be happening here in your body to make cholesterol. And they come in here and they interfere with all of this stuff. So dolicol and cholesterol. Oh, these are all important for preventing Alzheimer's and stuff like that, right? So cholesterol, where's the part I want to go to? CoQ10, rhabdomyolysis, that's a rapid breakdown of skeletal muscle tissue. Okay. Dolicol. Very few physicians know of the dolichols. Really? That's so surprising. Which play a pivotal role in synthesizing proteins, and Graveline argues neuropeptides throughout the body. Since neuropeptides are pivotal in your thoughts, emotions, and sensations, statins blocking their production can lead to significant issues. Dolicol abnormalities have also been linked to Alzheimer's disease. Additionally, the part of the brain where Parkinson's disease develops has a very high concentration of dolichols. Graveline, in turn, asserted that inhibition of dolicol production and therefore neuropeptide production accounts for the aggression, hostility, irritability, road rage, homicidal ideation. Homicidal ideation, that's like you want to kill people. Exacerbation of alcohol and drug addiction. I have Dr. May just chiming in for a second. I'm just going to interrupt that. Dr. May, she called me earlier this week. This is off the subject, Becca, but your eye drops also worked for my dog's irritated eyes within 2 days. Thank you. Yeah, she asked me would it be safe to use the eye drops in her dog's eyes, and I said sure. And that's really great news. I'm so glad. I'm so glad for your dog. And Jean says rhabdomyolysis is very painful, which she has experienced as well, not due to statin drugs, unfortunately. Okay, so these side effects are, it says, some of the saddest. So tau protein, many neurological disorders are thought to result from misfolded protein. So because statins interfere with mevalonate synthesis, Graveline theorized that the production of tau protein would be altered, which provides a potential explanation for the neurological diseases associated with statin usage. What's really interesting is, remember we were talking about when I did the Alzheimer's disease series, not just a very short time ago. And in there, we talked about high cholesterol among people with the APOE4 variety of the apolipoprotein E gene. And that they had a hard time getting the cholesterol into their brains where it needs to go. And that's why it was higher in their bloodstream. So what happens to a person? It's higher in their bloodstream. They go to the doctor gives them a statin drug, which interferes with all of this and just makes this worse, so much worse. There was the, I wanted to find, okay, more about the brain here. Hang on. This is talking about that silly thing that they try to ask you about to find out if you need a statin drug, and everybody will need one. Injury clotting, but I just wanted to find. Okay. All right. Well, that's the end of that. Anyway, there was something said in there about getting the cholesterol into the brain. And it has to do with something that starts with a C. That we can't make without cholesterol. The glial cells, there it is. The brain synapses, which amongst other things form memories, require cholesterol to function. Since cholesterol is too big to enter the brain, glial cells starts with a G. Glial cells support cells of the nervous system synthesize it within the brain. Statins, unfortunately, inhibit glial cell production of cholesterol. So this is bad. I will tell you right now that cholesterol-lowering medications are bad. They're not just bad for some people. They're bad. They're bad for everyone. Is there one form of cholesterol that can cause damage to the arteries? Yes, small particle LDL. So your small particles have a higher problem, but why? How do we make, because they're hard and gnarly little molecules, right? And they damage, they're inflammatory and they damage, they like take something that's scratching your arteries. And that's what it does. So how to make the hard, gnarly, inflammatory cholesterol harmless, like light, fluffy clouds? The answer will surprise you. Eating saturated fat, eating all those things your doctor says you can't have because your cholesterol is high. Butter, cheese, right? Dairy. Oh, can't have that fatty meat. Yum. That's how you make your cholesterol harmless. And I've presented that before. Some health benefits of saturated fat: improved cardiovascular risk factors, enlarges the LDL cholesterol, while it is a small particle LDL that is impacted in cardiovascular disease. The only way to lower LPA, small particle LDL, is eating saturated fat. These fats are stable and therefore do not oxidize, leading to production of free radicals that damage the arterial epithelium. We have been lied to, are being lied to. We need to just stand up and say no. Right? Wahoo! Pass the cheese, please. And by the way, statins do not decrease small density, low density lipoprotein, I should have said. Okay, so they don't even do that. It says our studies suggest that statin therapy, whether or not recipients have coronary artery disease, does not decrease the proportion of small dense LDL among total LDL particles, but in fact increases it. So the doctor says, oh, and the only cholesterol that damages your arteries is the small lipoprotein, small density lipoprotein, right? LDL. And they'll put you on a statin drug, but it doesn't even do that. And they'll put you on a statin drug and tell you you can't have any more butter. So that brings us to the end. I say you have much more power than you know. I want to go on in this cardiovascular, heart health, cardiovascular series. What does cause heart disease? Go a little bit more into that. I've covered it here and there with various topics, but let's talk about that. What about triglycerides? Triglycerides, I'm always more concerned with. High triglycerides, also statin drugs don't do anything about those. What about atrial fibrillation, AFib? How do we maybe control that? What about high blood pressure? Blood pressure, another kind of controversial topic in the world of medicine. And so anyway, great questions for another day. Let's do it. But what I want to say is, do not succumb to this, and do not, the man who wrote the, I say the man, but he doesn't really say, he said he's did he say he is the Midwestern doctor? And thank you so much, you guys. Thanks, Abigail. And okay, so he has a really good, a lot to say here about COVID. He has a lot. He's got 28 times he references it. And he really talks about the COVID vaccines, and he really talks about, he really talks a lot about the control that was exerted over us during COVID, and the same type of control where people get, labeled as an anti-statin person or whatever. And though that's been done to a lesser extent, we have to be very careful about how the system labels us and makes us enemies. I'm sure there'll be some sort of, I don't know if I put this one on YouTube, which I think I will, see what happens with that. But when you come against the system, there's a great strong arm of censorship. And anyway, thank you everybody for your comments, and thanks for being here. I always really appreciate this hour that we do together. Again, this will be up on my website. I'll send out a newsletter, but for those of you who don't get the newsletter, just go to my Rumble channel and my YouTube channel, Wondrous Roots, and you'll find them there. And I also will be putting up the PDF that I just went through with you. So that will be there so that you can go into that yourself at will. So anyway, I hope you have a wonderful day. It's a beautiful and a wonderful weekend. And Kathy, our prayers to God for you, for rapid healing. I'm just so glad you're here. And I'm just so blessed by all of you. Again, be well.